My name's Shelby. I'm a nursing major at Towson University. I graduate a year from this month, and I work at Johns Hopkins in a neuroscience brain rescue unit. So we go through about 3 days of training before we actually start on the unit to make sure that all of our skills are up to date and that we know exactly what we're doing, so that when we get put into a scenario, we don't have to kind of wobble around and ask other people how to do each procedure. So it's a lot harder than it looks, and it's actually really taxing. So before each shift, they come up with who's going to have what responsibility should there be a code incident, and then we kind of go from there. And it's kind of like an organized chaos when that happens, because everyone knows what they're supposed to do, and then we go through a rotation so that no one gets too tired.
12 West, this is Shelby.
Calling about patient Geroso. The patient's code status is DNR-DNI. The problem I'm calling about is high blood pressure. I'm afraid the patient is going into arrest. One of the first things we do every morning, we do a neurological assessment and we check for vital signs to see if there are any immediate things that are going wrong with the patient.
121/83.
It's a heavy job emotionally, and it can be physically, but it's by far the most rewarding thing I've ever done as far as patient communication and relationships with patients. It can be hard at times, but you can't discount the success stories for the ones that are not. Because it's a teaching hospital and it is a Johns Hopkins neurology and neurosurgery unit, they're very willing to teach you and show you anything, and we have people that fly in from all over the world to teach lectures here, and we'll actually have them in this room, and it's really cool to actually sit down and be part of that and to realize that what you have to say does matter, and that the doctors will include you and the nurses will include you, and it's just a really fulfilling and it's an easy to love kind of job.